I am extremely sorry. I'm extremely sorry for this. I sincerely didn't realize that I was muted. Yeah. So today's session is being taken by Pallium India's state facilitation team, which is headed by Shalini, which facilitates the development of palliative care services in all the states and union territories, envisioning the integration of palliative care into the entire healthcare system of India. Shalini has an experience of 22 years as a management professional, working with different multinational firms and delivering across positions in operations, project management, business development, client relations, advocacy, and training. So it's an honor for me to introduce Shalini to all of you, and she's going to take a very important session for all of us. At one point in time in all our careers, we will have to come across such situations where we will need to organize palliative care systems for our own setups. So over to you, Shalini.
Hi, thank you so much, Dr. Sangamitra. It's such an honor to be introduced by you after a long time. So nice to see you also. Just to show you my face to everyone, this is Shalini. I would request my team also to show their faces once. The entire state facilitation team has joined today. I would start with Ms. Sunanda. She takes care of the Central India. I have Mr. Rantu Sangma. He takes care of the Northeast region. We have Vishnu PR, who takes care of the Southern region, and Meenu, who's our back-end support. We have one person missing who's actually gone in the field meeting the NHM of Uttarakhand, Mr. Rajendra. He handles the entire North region. So a privilege. It's a privilege to be here. Thank you for having us. The whole idea about today's session is to actually be your additional arm for you, all you doctors. While you take care of the patients, while you take care of their physical, psychological, with the, and other pain with your team, we will take care of organizing a whole services and maintaining it for you. So that you don't have to worry about what license to pick, you don't have to worry about whom to recruit, how to train. So we'll take care of that. You just have to let us in and work with you. So to begin with, I'll start sharing.
Shalini, you already have a question here. Who is in the West? It's from Sanjay Pandya, Dr. Sanjay.
West in particular, sir, you're looking for? Of course, we are going to have a detail about every state. Any particularly in West? Ms. Sunanda,
from your team.
Yes. What I meant is there any particular state? We have Sunanda taking care of the central region, that is Gujarat, Maharashtra, MP, Orissa, Goa. So this is like, we have kind of divided. I'll show you in the screens the whole map of India. Yeah, Gujarat is managed by Sunanda.
Yes, Dr. Pandya. Sunanda looking after. Yeah.
So Sunanda, please take note of Dr. Pandya's number and get in touch with him.
Yes, and if you can just share your number in the chat, I'll get back to you.
Yes.
Okay. So let me start sharing my screen, and I do see I just want to say a personal hello to a few of the people that I know already. I think Dr. Raven, we have worked in Goa together. We have, I think, Dr. Evelyn from Mizoram, that's Civil Hospital Mizoram. We have, right, Dr. Alvin? That's you, right? Yeah. And we also, there's one more doctor, I'm forgetting. Dr. Mavis, who's in Goa, Shanti Avedna. So lovely to see some of the known faces, and I'm sure I'm going to get to know more of the doctors while we go through this session. Quickly sharing my screen now. Can this not go on? I hope all of you can see my screen. Okay, so how we organize palliative care, how to organize a palliative care. You doctors are already getting trained here to deal with patients, to diagnose them, to give them medicines and all. But how would you open up a palliative care center? You want to open up OP, you want to open up an inpatient or a clinic of your own, or probably just go in the community and serve them, or have just a home visit. So whichever way you want to take this further, we would be there to help you. I would want to start with the basic strategy that we learn, which is a WHO palliative care triangle. For any palliative care facility or for any palliative care advocacy, you will have to act as an advocate also within your organizations or in the field or with the masses in the community. There are three sides of triangle that you'll have to work on. One is the education. The first step you're already doing, you are getting trained yourself. And of course, you will have to train and orient other people. The hospital that you are in, you will have to train the government, the administration officials, or you have to speak to the government official. If you are in a government hospital, you will have to share about palliative care to the government hospital officials, the senior officials, or you'll have to train them, train your nurse, doctor, or social worker, the whole of palliative care team. That would be how you'll be handling the education side. Policies are already there in a lot of places. There is a whole national program of palliative care, which is run by the center and implemented by the state. There is a lot of states already have a policy on palliative care. It's just that it requires implementation and a lot of you to take a lead to implement those guidelines. And some of the states do not have policies. So we would encourage all of you to work towards having a palliative care policy or help us work with some people who can take this further. And of course, the drug availability. As doctors, you will not be able to run you will not be able to take care of any patient without the medicines are available. And somehow in India, I'm sure you have already attended an opioid availability session where they talk about how opioids have been inaccessible in certain part of India because of some laws which have not been implemented or some laws which in past have been very strict, but the amendments have not been implemented. So these are the three phases where we will be looking at how to develop palliative care in your region, in your hospital, in your clinic, or in your community. Please feel free to stop me anywhere and put your questions in the chat and we'll take it up. Just one look, how to organize a palliative care service. If you just have a look, this is a quick look. I'll just shut off my presentation, would end after this slide. So this is a gist of the entire slide. The very first step, you'll have to recruit and train a palliative care team. A basic palliative care team, you know, is a doctor, nurse, and a social worker. So you hire them, you get them trained. There are a lot of training options available. Of course, there is an HR to recruit, your own organization's HR, or Palliative India can help you in recruiting any of these three. You build an infrastructure. Now, for an infrastructure, you'll be requiring just a room for if you just want to start with an OPD, a room is needed. If you want to start an IP, then definitely, you know, a little bigger, the space, the beds, the furniture, everything would be required. And if you want to start a home care, then an additional vehicle. Somehow this home care thing is not coming up here, but so that's a building an infrastructure. So you have a team with you, you have the infrastructure with you. Now you will have to get all the permissions where you are in the hospital, if you're working in a hospital setting, government hospital, or in a private hospital, or in clinics, or you just want to start in community. You will have to create awareness about palliative care. You know that palliative care is not a very known subject in current scenario. So we have to create awareness around that. So I'll just take a pause here. How many of you are in a government setup here? Anyone? If you can just put in the chat. Or just raise a hand on your windows. Okay, Shri Parna Mandal is in a government setup. And Dr. Neetu Kadam, Dr. Raven, Hospicia Hospital, Goa. Great. So in government setup, there are different level of people that you'll have to talk to. If you're a district hospital, you'll have to talk to your, the district medical officer or whomsoever is the head of the hospital. You might have to speak to the state cell, state palliative care cell. You might have to go to, if nothing is there, you might have to go to the health secretary to convince him. So different levels, you'll have to create awareness, talk to them and tell them what palliative care is and what you want to do. Next, as establishing connects. Once you create the awareness, then you decide who's the right person who's going to help you. Like who's going to give you the budget, who's going to give you the license, who's going to help you with your, setting up your palliative care. And that's what you will, government official, administrators, civil societies, if in the society, in the community you want to go, who will be the NGOs or the socialites will be helping you there. How to procure opioids. There is a whole set of legal formalities that you'll have to do, the documentation you'll have to maintain to procure those medicines. I have given separate boxes for developing OP, IP, and home service because you can decide to do one thing at a time. You can decide that I'll just begin with OP, or you can decide I'll just begin with home service. Like being a doctor, I would really like to share an example. There was one doctor in Jamnagar Government Hospital, in a government hospital in Jamnagar, Gujarat. He was so passionate about palliative care that he just went on his motorbike, took the medicines, went on his motorbike and started visiting the patients in their houses. So he didn't need anything else but just medicines to be with him and visit the patients. So it depends how the basic things, if you have a team, you have your vehicle, you can start with home visit, you have a room, you can start an OPD, you have a hospital, you can start an IP. So depending on the resources available to you and your might, you can move on. Of course, as I mentioned, arrange funds, whether if you're a government organization, then you have funds coming in from the state government, from the center government for developing a palliative care. And if you are in a private hospital, then of course you will have to take permissions and ask your administrators to allow you to use the funds that they have. But if you really want to work in community and a charitable organization, then you might need to reach out to CSRs, donations, micro donations, and also involve volunteers, which are the social capital, so that you don't have to spend money on the human resource, the social capital. So in a nutshell, this is what all you would need to organize a palliative care. We'll go into the details. We will have our regional coordinators talk to you about their experience from the field. How did they, what all challenges they faced when they went out to meet a doctor and try to help him develop a center. Can you check if there are, I'll just take a pause if there are questions.
There are no questions. Dr. Neetu Kadam had raised her hand.
Yeah.
Dr. Neetu, you have something?
Do we have there is a question, do we have a business model to generate a profit and loss for corporate setups? Dr. Sanjay Pandya, there is a profit and loss. I would not say there is a proper profit and loss statement, but yes, we are working with some private hospitals to develop palliative care. We have not yet got a whole statement ready. We are yet to do that. We are still in the process. But that's a very good thought. We'll keep in our mind and have a separate profit and loss statement created for your help. But we do have a budget that we can share with you when you want to open up a palliative care center, depending on which service you want to open first.
Madam, just wanted to know because mostly this type of care is taken care by charity organization. So if there is a business model available, so that we can explain to a corporate setup so that better palliative care can be delivered by them. If there is a business model, they will agree. Otherwise, if it is a charity, they will not agree. So I need that help if required.
Sure, sir. We'll take a note. We'll separately connect with you and understand the resources that you have, and then build a model specifically for your hospital. We don't have a standard model right now. Rather, we are going to present Kerala model to you right now at this time. But what models work for you, we can discuss it separately. I would suggest, we are taking a note of that, and then we will get back to you on it. So quickly move on. Of course, you know palliative care definition, both philosophy of care and organized high structure system for delivery care. Because it's to be given to life-threatening and debilitating illness, the diagnosis is from till death and then and beyond for the bereavement care of the family. So when we are organizing a palliative care facility, we have to ensure that we are able to cater to all these three stages for a patient and a caregiver. And it requires an interdisciplinary approach and a coordinated continuity of care across multiple healthcare settings. So you will be delivering palliative care in the hospital, you'll be delivering palliative care at home, in a hospice, or a long-term care, quite like for paraplegic and quadriplegics, you'll be giving palliative care at home, or they might be coming to your center. I'm sure you have already gone through these things. I'm just picking them for connecting to what is coming up. You will have, in a hospital, you will definitely have doctor, nurses, pharmacists, social workers, whomsoever you can get involved depending on your resources. And of course, the family and other caregivers. We will be involving all of them when we are setting up a palliative care unit. I'm just getting distracted by a question. Is this specific topic also covered in the classes for medical social workers and psychologists? Since from my hospital team, they have been appointed to help with an administrative part of setup. Correct. Dr. Sujata, very good question, actually. We also have different training programs where psychologists and a lot of administrators join in. We have a volunteer training program. We have a foundation course in palliative care. They join in to understand how to set up palliative care and which all resources they can utilize and how they can utilize to build a palliative care center. So we are going to be working with anyone who can contribute to improving the quality of life of the patient and the family, and who can help us set up a center. They can be businessmen, they can be housewives, they can be students, they can be your administrators, or the government officials, or someone. I always call they like people with little hearts. You will find who are kind and generous and who want to do some help in this field. I can share an example that one of the states where we were trying to build palliative care, which was not very established, the principal health secretary had an ailing father. And when we reached out to him and asked him to have a workshop for his doctors through the Directorate of Health Services, he was so happy, and he stayed through the entire program and ensured and handed over to the person who could take charge instantly. So I think anyone whom you feel can help you, you will have to identify that person within your setup where you are working. This is what Kerala palliative care model is. What generally works in Kerala, what we have seen, we have been across India. in different states have different models. We don't say Kerala model would work out in your state, because Kerala has some political structure or a political theory, and the systems and infrastructures are such. There are a lot of civil societies are here, which can help us take care of this model. So primarily this model is where there is a doctor, a micro person, probably you, just individual you, and there is a macro level, that is the hospital, where the hospital is. So the patient either can come to an individual doctor, or the patient goes to a hospital. In between, there is a meso level that we have introduced in Kerala, that is community, where the volunteers join hand to bring the individual patient to the facility at the hospital. Now, you have to see where you would be wanting to open up your palliative care center. Do you want to open up at micro level, just you and your clinic? Do you want to open up at a meso level, where you want to work with the community and go in the community centers, or probably in a gurdwara, or in a religious organization or some charitable organization, and just be there for 2 hours? Or in a macro, that is a big hospital, private or government, where you would want to set up a palliative care center. So it just describes in detail the macro level, the micro level, where you can directly reach out to the family. And most of the challenges actually can be addressed by engaging the community. Again, it is very Kerala specific. They are able to utilize this social capital very strongly, but we would not say that this would work out elsewhere also. We have tried, our whole team has been working for a lot of community engagement. We have worked in different states, tried to develop community, social capital in the community, but not been so successful as we have been successful in Kerala. But volunteer is a strong, strong social capital. So see if you find the person in your hospital. Basically, a volunteer is a person who actively takes on a task, responsibility, or project on his own, her own accord, without needing to be assigned, ordered, or told to do so. So volunteer, please keep in your mind, can be an additional team member beyond doctor, nurse, and a social worker. Sometimes he can act as a social worker also and take care of things. This is about one of the volunteers who have been working in Kerala, in Palliative, India. We would just want to share how he helped us. He's a 70-year-old gentleman who joined army at the age of 17 and got retired in 1992. In 2002, when she was 45, his wife was 45, she was diagnosed with stage 3 cancer, and she passed away in 2004. That left Mr. Nair with the feeling of that what my wife has gone through, I would not let others go through that. And that's when he started giving his services to our center and came in and started managing our training center. So he would take care of all the classes that would be happening. He would take care of the participants, like what you guys are right now on virtual platform. He would take care of all the trainees when they would come here for a residential program. But due to COVID, this was discontinued, so he's not able to continue his services to Palliative India. And of course, because he's above 60, so most of our volunteers have stopped coming to the center for now. Now, this is the Palliative India model. What are we doing? How are we facilitating these palliative care centers? This talks about, the first thing it talks about is, this is what we have in Trivandrum. Thiruvananthapuram, that's what it's called now. This is our Palliative India setup. The Trivandrum Institute of Palliative Sciences, the WHO collaborating center. We have link centers and OPDs in hospitals, government hospitals, community centers, local NGOs we have partnered with. And we have vehicles, around 5-6 vehicles go out every day to take care of the patients in their houses, at their homes. And this is what we were able to achieve here through community engagement. And this is the whole model which we have here at TIPS. Now, what we are doing is we are trying to take this model through a strategy of demonstrate, educate, and facilitate. This whole model is getting demonstrated in Trivandrum, Pallium, India here. So the very first thing a lot of people want to know is, how are you delivering palliative care services at your place, in your hospital? They want to come here, they want to visit us, they want to see how Pallium India is delivering. So we organize a visit for them. So you are most welcome. Of course, with the COVID restrictions, we have our limitations. But in any day, if you want to come here and see how Pallium India is delivering, we will be able to demonstrate to you here. We are educating the people to open up palliative care services, and that is what this training program is all about. Trying to educate the doctors how to give palliative care, the nurses, a different program, and of course, a lot of programs for volunteers and administrators. And facilitate, that is the primary objective for our team, the state facilitation team. Wherever a doctor or anybody who's interested in palliative care and who wants to open up a palliative care center, they connect with us. They let us know what are the problems that they are facing, what are the resources that they have, and how would they want to what extent they would want to develop a palliative care center. And we facilitate that, whether we have to get them a license, whether we have to get them some patient assessment forms, or whether we have to get them some local help, local funding. We try to connect through our contacts and help them, or through their contacts, create awareness and help them. So this is what Pallium India model is. So the business model you were asking for corporates, we have not yet developed it, but this is the model that our facilitation team has developed, which we are trying to take it across. So the first thing, demonstration. Our Pallium India Center is an inpatient care unit. We have an outpatient care unit in this building also, and in the government hospitals. We have home care, we have rehabilitation and reintegration. Like we have our lot of people who are suffering with spine injuries, or who are not able to work with their legs or hands, the quadriplegics and the paraplegics, to get them back to their regular lives. We have a halfway home where we bring them to our center, provide them with the facility, and help them with getting back to their routines, like cooking, staying with their family, and they come and stay with their families here. Again, because of COVID, it is on hold, but this is one of the projects that we are doing with the Kerala government. And of course, we have community participation through link centers. There are 14 link centers we have, and with 87 volunteers. This is one of the link centers where you see a lot of our volunteers are there. Patients' families have come to understand what can be provided to them in terms of medical services, in terms of social support, or psychological support, or any kind of rehabilitation help that they need. This is a small glimpse of home visit. I'm just making you go through what happens at Pallium India, so that you have an image in your mind what kind of palliative care center you want to run. Out of this, some of the things might not gel with your circumstances. So just have it in your mind, an image of palliative care service that is run here, and then develop it as per your resources. You see Dr. Rajgopal going up a hill. I'm sure a lot of you are from the places where are very hilly regions, and you'll have to do home visits to the patients who are tucked up at the top of a hill or down the hill somewhere. All kind of people receiving the home visits, whether it's poor, whether they can pay, not pay. Private hospitals might ask for payment, but I'm sure there would be certain percentage of people, of services that they would want to give it out free. This is one model. This is one example of rehabilitation that we had in Pallium India. This patient was met with an accident and lost the capability of walking and working with hands. He did not have any physiotherapy equipment to walk, or like treadmills and all that we have in cities. And his house was also very far off, somewhere in the village. So this is a basic, very basic way that we helped the person to just start doing walking practice within the house. We just put in two poles, and so that he can hold and he can practice walking. Rehabilitation for Palliative India, it includes giving some kind of job or some vocational training, like giving away a sewing machine to a patient and his family. These are the things that you can think of. We're showing you a complete picture from starting a palliative care center to going beyond. You think right now you just want to treat patients and take care of them, you stop till there. But you think slowly you want to get into rehabilitation, you want to get into job provision, or you want to further, we'll see 2-3 things. We are going to show you a complete picture of what Palliative India is doing, and then you can pick from there how you want to go about it. So you see, then there's umbrella making and all. We get all these products, umbrella making, candle making, jewelry. We get all these products in our center here. We display and people purchase them, which again help our patients and their families. This is Rahul. He is suffering from juvenile arthritis, and he was just tucked up in his room. His mother had to carry him all the time. Just this one wheelchair that we gave it to him helped him move around easily. So do you want to go into that kind of, would you want to expand your palliative care center to this way, that you can provide supporting equipments to them so that your patients can be looked after? And not just medicines, but food too. When there are poor people who do not have food at home to eat, how will they eat medicines? Or they can't eat medicines empty stomach. So what we try to do is give them basic food kits also. So that's an extension that we have started off. Palliative India has been working for the last 18 years. So slowly we picked up all these things. So now we have a basic food kit with rice, dal, and certain daily items like spices and all, which is provided to all our poor patients. And we take care of the families beyond, as you say, beyond the death, even when bereaved families, where the children are generally the maximum impacted. They don't know what to do because the father has passed away, mother has passed away, or there has been no earning because one person is sick. So we try to take care of them, try to get them educational loan. We try to get them, get career counseling or take them out just to have a light day so that they get out of that environment of sickness all the time and feel their age and be children again. We also run helplines, palliative care telehealth helpline. We have where you can call in. Even doctors can call in if you have a patient that you want to discuss. You can call in and consult our doctors here. And there is also a provision to provide morphine by courier. So you can call up and speak to our doctors here. And we also have a helpline with Sukh Dukh helpline, that is for mental support, for any emotional support by trained and experienced counselor. So, and it is available in regional languages. You can call up or share with your patients or caregivers, anyone who needs it. Yeah, so this was what this is what Palliative India model has been. This is what is going on in Kerala. But now, how further we can do it? This is the demonstration that we did about a model that is running right now. I have a question by Mr. Sanjay Pandya. Preparing next team of volunteers in various ways, giving help to children, you would have real life experience for the same also. It's comment only. Okay. Thank you, Dr. Sanjay, for your comment. Yes, there are a lot of real life experiences that we have here. Okay, so moving on, what else we do? So that is a demonstration. We tell you how a palliative care center is run with so many extensions. Then we provide you the support of education. We have ECHO platform, which is Project ECHO, which is extension of community health outcomes. This is a platform where we can bring a lot of healthcare workers like you and get them trained. So that's why we are able to run virtual programs very beautifully. And this came up during COVID era only more, because we could not have our residential program. So there are 3 types of education programs we are giving: residential, online, and on-site. Residential, when the people, doctors and nurses come here, volunteers come here in Trivandrum, in Palliative, India, and they see how we are delivering the service. Online, through the way we are talking today. And on-site, we have conducted a lot of foundation training programs, foundation course in palliative medicine, foundation course in palliative nursing for volunteers on-site. We conducted a couple of times in Goa, we conducted once in Mizoram, we conducted one in Haryana, Meghalaya, and we train all the people who can be trained. So this is the education support you can get from Palliative India. There is a complete list of programs. I'm sure when the presentation will be shared with you, you can go through it and you would find that there is course for doctors, nurse, all administrators. There are course for beneficiaries. Like if you see your patient or a patient's family, they want to contribute something to palliative care. This is Arohan is the program that you should suggest them to attend, where particularly they bring their experience and then they try to advocate for palliative care. Refresher courses, a lot of volunteer programs, students programs. Some of the last 3 things we can do, particularly for doctors like you: awareness sessions. You want to create awareness within your hospital, we can help you with ECHO programs. We can help you organize an awareness session in your hospital. We can send a faculty from here and we can arrange an awareness session. Orientation programs, you want your entire hospital staff to undergo an orientation on palliative care. You want to create and have an orientation program for government officials or your donors whom you think need to know what it is. So we can have a complete orientation program for 2 to 3 days, making them really undergo the entire understanding of what is palliative care, how do we deliver it, and what all is needed to run palliative care center. And a very, very important workshop, opioid availability workshop. So opioid availability, I'm not too sure. Have they gone through the opioid availability session? No. Okay. So you would be going through an opioid availability session, which will tell you how can you procure opioids at your center, whichever, a clinic, a hospital, or an institute, or for that matter, even home care center that you want to develop. How will you be able to procure opioid? And that's what we address. Opioid availability workshops we do for state drug controllers and the government officials. So just to understand whether they know how to give the required license, whether they know the new law, which every institute needs to have. It's called the Registered Medical Institute Certificate. That is a 3G certificate particularly. You do not require any other license, anything else for procuring opioid except that 3G certificate. So we conduct these workshops addressed to the state controller, state drug controller, or we conduct these workshops for the medical fraternity in your hospital, your pharmacist, your other people who are involved in stocking and procuring. And we tell them what all is needed so that you get an uninterrupted supply of opioids. As I mentioned, sessions can be organized in regional languages as per the batch strength. So if you get us the people like 50, 60, we can have an individual session for you. If people are just 2, 3, then we'll have to see how we can arrange it, because getting a faculty involved would be tougher. when it is just a matter of 2-3 people. TIPS residential program. These are the programs where you can send teams here in Trivandrum and get them trained. But these programs are limited to 5 programs: foundation course, which is for 10 days, both for doctors and nurses; 6 weeks, which is both for doctors and nurses; and volunteer training program, which is offered in Malayalam and English for 3 days. But this is on hold due to COVID. We are planning to start again from January, but let's see if we are able to do it. This is the on-site programs where we come with all our faculty and the managed, like one of our regional coordinators would come to your site, to your hospital, and conduct a 10-day foundation course continuously for doctors, nurses, volunteers, or we'll have awareness session, orientation program, or opioid availability. This is something we can do at your site. You don't have to come to Palliative India for that. Now, palliative care can be, as we have already talked about, they can be run in 3 different ways. One is standalone, when you individually want to have a clinic or you want to do it yourself within a hospital, or community-based. I already mentioned that. Some of the very basic essentials when you're starting a palliative care, standard audit tool for Indian palliative care programs. Wherever the palliative care centers are running, this is a standard audit tool for that, how these programs are running and where they need to improve. So these are the documents that our regional coordinators can share with you, explain to you in detail. I'm not going to go in detail in this, but if you see just the first one, the type of service that you are trying to look for: government, private, standalone, NGO, community, medical college, and others. And accordingly, you will be audited. The part B talks about the desirable things. The part A would talk about, Part A talks about essentials. What is very essential for a palliative care unit, how you are assessing and documenting the documentation, whether you have access to essential medicines or not, what kind of approach you are using, whether you're engaging community or you're working in isolation, and kind of services that you're providing to your patients, and what kind of program that you have for training them. Now, this is where our state facilitation division comes, where we are facilitating new palliative care centers. We are sharing information, knowledge, whatever I'm sharing with you today is shared by each of the regional coordinator with each person separately, whosoever approaches us. We collaborate with public and private stakeholders. We have opioids available. We have community engagement in one of the hospice, existing palliative care center, which works with the cancer hospital in Nagpur. I'm not too sure if any of you know, probably people from Goa might know. There is a hospice in Nagpur, which is called Snehachal. Dr. Rukmini Lobo, who's in Goa now, used to work in Snehachal. And we are working with that organization right now to expand their services in the community. So right till now, they had that hospice where the patients would come and get admitted and they'll look after them. And it was very specific to cancer only. But now they want to expand, they want to go out in community. So they are reaching out to the slums of Nagpur and trying to connect with the ASHA workers, the social workers, the NGOs which are already working in community. And they are trying to open up OPDs there. And Palliative India is proud to be working together with them and trying to learn from customizing whatever Palliative India model is with their available resources. And one of the big things that we also do is facilitate learning in medical institutes. So this is something, as you all know, doctors, in MBBS earlier, we did not have anything about palliative care except under cancer treatment or something about pain clinics and all. But now there is a separate module added, EdCom module, where they talk about attitudes, ethics, and communication. which is not a complete syllabus of palliative care, but still touches upon a lot of aspects of dealing with patients. So this is all because of palliative care advocates like Dr. Rajgopal and his colleagues, that this particular curriculum was included in MBBS in 2018, I believe. That's when it happened. So we go to the universities, we go to the colleges and tell them what all topics to be included. We run their syllabus. And so if any of you are from medical colleges and you feel that your students need to be taught palliative care, there is a syllabus already there. You would want your teachers to be trained on palliative care. Please reach out to us. We have a complete syllabus and we will deliver that training to your teachers, and then they can further talk to their students. Again, the same, how state facilitation is working through the demonstrate, educate, facilitate model. Demonstrate, I have just talked to you about Pallium India, what Pallium India is doing in Trivandrum. But we also see how we can demonstrate other models that we have seen in other states to you. Like recently we visited Northeast, and there in Manipur, we had health and wellness centers. You must have heard, people in government hospitals, you must have heard that there are health and wellness centers under the Ayushman Bharat scheme. And there was a beautiful health and wellness center where I think our Northeast coordinator would talk to you, Mr. Ramtu Sangma would talk to you about it, and I will show you the picture as well, where the nurse, who's the community health officer with ASHA workers, is conducting home services and home care services and delivering palliative care to them. So it is not just about palliative care in tips, but what all is happening in other states also. Our state facilitation team try to share those examples, and then it's like best practice sharing from around the states and offering it to you in one plate. We have also created some basic guidelines for palliative care model, that these things should definitely be there. We have documents ready with us. Dr. Raj has written a document. We all have come out with a document, what OPD should have, what an IPD should have, and what a home care should have, listing down to each and everything, which can be further customized to your resources. We are educating everyone. I have already talked to you, and we are also trying to bring a cultural change in the mindset through orientation and capacity. A lot of communities are not aware about palliative care. They are not asking about it because they don't know about it. That no, generally what happens, even in my own house, when my grandmom was at the last stage of her ailment, everybody said, no, she has to bear pain now. Now the end is near, she just has to bear pain. But when I got to know about palliative care, I knew that she does not have to bear pain like this. So I invited a palliative care doctor home, and she could really let her go without suffering, just quietly with no pain. And through her medicine, she was able to take care of that. So changing the whole cultural mindset is also where we are working, and facilitating integration of palliative care at all 3 levels of healthcare. In Dr. Rajgopal's word, if a patient enters a hospital, his pain should be assessed completely. His complete suffering should be assessed. Serious health-related suffering should be assessed, from how much pain he's having physically, how much pain he's having socially, and how we can integrate that palliative care so that every doctor has a palliative care approach whenever he's seeing his patient, whether the doctor is a gynecologist, whether the doctor is an oncologist, or any field. But when he's looking at him, he's looking at pain, he's looking at the person, not just as the container of his specified disease, but a human, a person. I'll take you a personal example. I know a lady who went through a COVID recently in this COVID phase, and she went through a CT scan during COVID because her lungs were impacted. And during the CT scan, there was a big lump that was clearly shown on the X-ray. And the doctor only focused on the lungs. He did not tell her that there is a big lump on your breast which needs to be taken care. Now, that is the kind of, palliative care that we are trying to bring to your, in all the doctors, that if you are seeing right in front of you that the patient is suffering from another disease or another ailment needs to be taken care, I think, please, we would urge you that you let the patient know and just don't treat the patient as a container of your disease that you are trained to handle. In detail, a quick look will tell you what all we can do. Of some of the things I've already talked about: organizing awareness programs, training, talking to the state drug controller, connecting with National Health Mission, Directorate of Health Services, educating your pharmacists. We have been to hospitals where we sat down with the pharmacists and told them that, okay, you have to do all these things. We have created proposals for organizations where a doctor said, I want to create a proposal to give to the head of my hospital that we should run a palliative care unit. So we created a proposal for developing a new palliative care with OP, IP, and home care service. We showed them documentation, record maintenance, the way it is being kept in Kerala and the way it is to be kept as per the law. The budget estimations, we will customize the budget depending on your resources. Recruitment support, through our website, we provide job advertisements. A lot of hospitals come to us that we need a doctor and we want some CVs for the doctors who can help in our palliative care. So there are hospitals in South, rather in all over India, that we have advertised on our website as job opportunities, and people have recruited them with our support. Infrastructure guidelines, how your building should look, what kind of accessibility it needs to have, what kind of architecture it needs to have. All that guidance we can give you if you're thinking of building a whole hospice of yourself. The whole process of procuring and dispensing opioids. Patient referral. Within the hospital, you think you are just limited to one department, you would want referrals from all other departments. We are happy to create an awareness in your hospital. You want other doctors in your region to send their patients for palliative care to you. We are happy to come and have that awareness session created in your region. Developing IC material. IC material is information, education, and communication. That is the material that basically means anything that you can share with the other person to make them understand what a concept is. So what is palliative care? We have some posters, we have some basic palliative care definitions, myths, challenges that we can share with you. You can further share in your groups or with the people whom you want to share what palliative care is. Facilitation of government health infrastructure. There are funds available, as I mentioned already. There is a national program of palliative care. There are funds available to be given to every government hospital to develop a palliative care center. We can come to you and talk to you in detail about it and help you understand it. There are funds available at health and wellness centers through Ayushman Bharat, how to develop palliative care. So we can facilitate those funds for you. Community engagement at a local site, go and talk to your sponsors, your donors. We are happy to do that. Monitor and evaluate new palliative care center. You already have a palliative care center or you have recently opened up. You want some monitoring, like the 10 the essential tool, audit tool that we just showed you. We will come and monitor and evaluate and share that finding with you so that you can further develop it. The volunteer network, we can help you develop one. And of course, the website support. We have a website, which is and we have a newsletter. We have one regular blog that is written by all the updates on palliative care around, and of course about Pallium India. And we provide all the addresses of palliative care center across India on our website directory. We have a directory of palliative care centers around India. If you'll visit Palliative India website, you will see that. And you can select by the state and see whether your hospital's name is there or not. If you think your name should be there also because you are a palliative care, you're giving palliative care service, please write to us or reach out to any of the regional coordinator and we'll update it. There's a question, I think. Holistic care is a basic family medicine. Unfortunately, in the era of super specialty medicine has become compartmentalized. Correct. Agree with you, Dr. Sujata, but that's what we all are working towards, trying to bring a change. All support with what charges? Is it package or individualized? Will it be considered franchisee or it can be independent? Good question, Dr. Sanjay. Palliative India has a model of collaborating only. We do not open up franchisee centers. We will come help you with whatever you need. Basic resources and infrastructure will be yours. We will provide all the support, the things that we have listed here. If it is a private organization, there might be certain basic consultation fee. We might ask you, we might not ask you, depending on if you're a charitable organization or you do not have a budget for that. We can have separate discussions on it. And whether you are trying to create a facility, for-profit facility or charitable facility, it depends on that also. So Palliative India does not believe in charging for the guidance that we give. Government hospitals is completely free. We do not charge anything for any kind of support if it is a government hospital. For private, for-profit organizations, we might charge. Charitable, it depends on the requirement. We can discuss about it. I think I've almost taken a complete 1 hour. So I think I'll invite Sunanda now, our regional coordinator, who would talk to you about the barriers of when we were working with different doctors and different institutes, what all challenges do we face and what all problems that they come up with and how we handle it. Sunanda would also talk about the centers that she has worked with. So Sunanda, all over to you and let me know, I'll keep changing the slides. Okay.
Yes, thank you. Thank you, Shalini. So good evening, everybody. And before I start my presentation, like sharing, I have something to say. I have special regards for all the doctors, and I'm so glad that I'm here today to, talk to so many of you. It's a real pleasure for me. Thank you. So, okay. So let me just tell about myself. I joined Palliative India recently, and I have started working with few states now. I haven't visited. I've visited only a few. Currently based at Pune. So quickly coming to the presentation, like barriers and challenges. As we all know, wherever we do some kind of work, there is some kind of barrier we face, some challenges. So we have just categorized it. First one would be the lack of awareness, as we always talk about, like many of the people, like even Shalini was sharing, that they're still not aware of the concept called palliative care, whether it's the medical fraternity or the government officials or even the general public. And the next one would be the lack of knowledge about the government programs on palliative care. And that's the NPPC Health and Wellness Center, as said by Shalini, and also the state policies and program around palliative care. And next would be the lack of information on opioid availability and the process. Most of them are really stuck at this point, I would say, with my own experience. They don't know how to move ahead, how to, get on to the, and ensure that they get the accessibility to opioids. So that's the reason we regional coordinators make a point to meet the state drugs controller offices in all the states, and also we approach many of the medical institutes. Next slide, please. Yeah. And I think everybody will agree that there's always a reluctance to change, whether it's government officials or the private partners, especially about the amendments in the NPS that was done. And also they, ask for like budgets. I mean, they do not actually ask for budgets, especially for palliative care and the PIPs. Coming to the medical fraternity to accept palliative care beyond cancer. I have visited, my experience is that I visited somewhere. So they're still looking at palliative care that it's only for cancer, which is not. Actually, it's a myth. So it can be for everything. And also to accept that it is from the time of diagnosis. So it's not like just the end of life care. And about prescribing opioids, referring patients, that is another challenge, because always they have late referrals. That is one of the challenge. And one interesting point that has come up is that most of them, they are scared of procuring opioids because they are not very confident about whether it's going to be misused or not. And also one point is that there's no pleasure of saving a life, which is very sad. So coming to the next, general
I'm sorry,
public.
Sunanda, would want to interrupt you here. That's a personal experience I want to share with this group of audience particularly. I know a lot of you might not like me making this statement, but that's a right statement. Palliative care is given a stepmotherly treatment because every doctor, that's what even my mother says, who has retired as a nurse, she says, we will save the patient. Our first thing is we'll save the patient till the last breath. We have to give life to the patient. Whatever we can do till the last breath, we'll do that. And that's what I think kind of every doctor feels, that if he's able to save life, he's a winner. But if he's not able to save life, he's a loser. And you are here, that clearly says that you believe in palliative care, but there are still a lot of medical professionals outside. I would not say just doctors, but administrators, government officials, a lot of them still feel that what is it? It is, if somebody is going to die, why are you spending more money on that? Even the government officials who are giving PI, one of the topics that Sunanda talked about, asking for budget for palliative care in PIP. There is a certain flexi pool, an amount of budget given to every state that you ask for budget for different programs. So they want to ask for budget for substance abuse, malaria, everywhere where they can save lives. But nobody wants to ask for budget for palliative care because for them it is a lost cause. The person is in any case going to die. You are not will be able to put the person right. So that's why let's not spend money. Let's not spend more efforts on it. So that is why this has been put in. And sorry if I offended anyone, but that has been an experience from the field. And I just wanted to highlight that. Thank you, Sunanda. Sorry to interrupt.
Yeah, it's okay. Thank you, Shalini, and I agree with you. And I can see in the chat, Dr. Sanjay has wrote that even the patient and the caregivers feel that way. Very correct. I agree with you, Dr. Sanjay. Everything starts from our home. I mean, if we as caregivers do not feel that, the patient, like Shalini was sharing, we have to feel the pain and make sure that what best can be done to, relax them, and they should not get, they should die painless, So I agree with you, Dr. Sanjay. So moving on to the presentation. Yes, 13 years of palliative care and I still face it. Yeah, agree.
Yes, Dr. Sanjay. Yeah. Thank you.
Thanks. Okay, so coming on to the slide, like, we were talking about, so a lot of things like palliative care and use of opioids, like morphine. Coming to hospital administration, it's again a very sentimental factor. Like some of them feel that it's not a profit earning business, so they are not for it. And again, they feel that it's only for the dying. And as Shalini was saying, that reallocation of resources to a lost cause. So next slide, please. Yeah, Shalini, can we quickly move on to the slides that
you want to talk about your slides? Would you
I
like
can
to?
just I want to finish it off and then we can.
Yeah, sure. I'm sorry, I placed it wrongly.
It's okay.
I'll just quickly do that. 1 second. Meanwhile, we can have some questions if any of you are interested.
I think somebody in the participant was looking for the phone numbers of all the regional coordinators. So I
We are
think
going
Meenu has
to,
already typed it and it's there in the chat, or otherwise we'll also send you later on.
we are going to show it
Okay.
on our slides. So.
Yeah.
Okay, I'll just start sharing again. I'm sorry, it's taking little time. Yeah, here you go. Nanda, you're muted. Yeah.
Yes, so sorry. So this is the slide which says about what are the states I'm looking after: Gujarat, Daman, Diu, Nagar and Dadra Haveli, Madhya Pradesh, Maharashtra, Chhattisgarh, Orissa, Telangana, Andhra Pradesh, Goa and Karnataka. So any one of you are from these states can contact me. Next slide, please.
My computer is not listening to me, so I'm so sorry.
Okay, okay. Okay, I think we can stop here and
Okay,
just
okay.
try once.
We
Yeah,
got
yeah.
it. We got it.
Okay, thank you.
Yeah,
Yeah.
go ahead.
So I have like categorized into two parts of my, whatever challenges I've experienced in my, approaching the government sector. So I've made it two slides, one for the government sector and one for the private ones. So for me, like, getting an appointment has always been a big challenge, like, to reach them and, get them on call or something. And if at all I get an appointment, waiting time is too much. So, you'll go to the office and almost I've spent in office about more than 2 hours. So that's, I feel, a big challenge. And then sometimes last minute cancellation. I understand they have other priorities, but still I've put that in one of my challenges. And yeah, another one is you have to really, be quick enough to say more in less time, because they do not have time. They're busy with so many things at one go. And then I feel that palliative care is never in the top priority list. Okay, like, okay, fine, that's fine. They never prioritize that. And then sometimes endless follow-ups are required, like you keep on calling them, sending them emails and following up. Okay, and I feel that they're not much influenced by the NGO's initiative. You come and say, introduce yourself, that I'm from my NGO and doing this, and blah, blah. So, okay, fine. But then I don't think they're much influenced by that. And last but not the least, money matters. So, like, they'll always ask about what's the cost and all that, which is obvious. They want to know it. But then we do have some free trainings also, but I feel they're underrated. So that's my challenge. It's my experience, absolutely. So next slide, please. Okay. I have actually approached many of the private hospitals these days and some organizations also who are doing palliative care in their own areas. So this point number one goes for everybody, that there is a lot of myths going around on palliative care, that it's only for cancer patients. I think much has to be done for this. And again, I repeat that some of them feel that it's not a very lucrative business, and some are scared and don't want to really procure opioids. I visited one of the organizations. They are actually looking, they have a OPD, they have a IPD, and but they do not procure opioids. They refer it. So maybe this must be one of the reasons. Then again, inadequate knowledge of palliative care and amendments of the relevant laws. That's one of the challenge we feel. And in some cases, there have been limited trained human resources. They do not have people who are trained enough to, go ahead with this kind of setup. Then late reference, as I've already mentioned. And yeah, some of them were really hesitant to share their good practices. When I wanted to, meet them or go to their setups and see what they're doing just to understand and but I was not very welcome there. So that's why I put this. And then there's another question, that there's always a question about our presence as a state. I think Shalini has already mentioned that though we work for different states, we do not have an office in each state. Okay, so like I'm based out in Pune. I don't have an office here, but I reach out to so many offices in Pune, Mumbai, and other places. So some people think that if there's something going on, so the person should have an office. So that's all from my side, and thank you for listening. And I'm sorry if I've hurt anybody's sentiments. Thank you very much. Namaste.
Thank you, Sananda. I just want to pick on Sananda's last point, where there is a question on our presence in the state. We definitely do not have our small Pallium Indias created in every state, but we have our collaborated centers. We have our hands-on training partners. We have our mentors sitting in different states. We have our different palliative care centers whose names are there on our website also, and we always encourage patients to go there. And if anybody wants to see a palliative care center, suppose one of you want to see a palliative care center, and if you are in Srinagar, so Dr. Tuba is here from Sher Kashmir in Srinagar, and we are collaborating with them to develop their centers. So we will send any of you to go to their centers and see how they are running palliative care center. Yeah, there is another institute, M&J Institute in Hyderabad, which is a very, very famous palliative care center. They are particularly specializing in pediatric palliative care. We have Dr. Gayatri Palath there in Hyderabad. We have Tata Memorial Hospital in Mumbai, which is a very good palliative care center. We have Dilasa Palliative Care Center in Goa. Dr. Raven knows about it. We have in Goa Medical College, there is a palliative care center running. So whenever there is a palliative care center which is needed for the patient, or even to just help the new palliative care centers to come up, we always connect them to their local partners, local available palliative care centers, so that you know how to develop a palliative care center with your limited settings, with your cultural settings. Okay, I think, thank you, Sananda. We will invite, I think we'll quickly go through the pictures. So that's Sananda with the team of Rehabilitation and Palliative Care Center in Bhubaneswar. That's with Cipla Palliative Care Center in Pune when she visited them, and we are exploring our collaboration with them. We are actually already collaborating on many projects, but to collaborate further. And this is the team of Kalpavriksha Hospice in Pune, where she visited the team. Now I would invite Mr. Rantu Sangma to share about his experience from the field and introduce himself. Rantu, all about you.
Yeah, good afternoon, everyone. So I am the regional coordinator for Northeast India. So these are the states that I am handling, and yes. So and next slide, please. So we had the opportunity to visit some states last month, and we were very excited to visit those states. So we out here in the photo, you can see on the right, on the left side, you hit a drug controller. On the right side, the NPPC nodal officer. So we had a wonderful discussion with them. In fact, when we met the drugs controller, even though they are not right now following the new law process because of some local challenges, but at the same time we were well received, and we discussed with him, and we also share a few gazette documents with him, what are the new process of procuring RMI license. So yes, and he also assured us that whoever private institution comes to him for getting this license, he will definitely help them. So that is something very, very good to hear it. And we have this on the right side, we have NPPC nodal officer. You can say she is the main person for palliative care. So we should get in touch with them, especially when we work with the government. Yes. Next slide, please. And we also visit here. So we visit their state nodal officer trains. So we have two doctors out there who already trained in palliative care. Dr. Tassi Choton, who is an NPPC nodal officer, and we have the other nodal officer for trains, Dr. Hagi Yeah. So so they have so they are developing their team, and they also have a palliative care unit now, 4-bedded, which is, in fact, they are growing up. In fact, we also had a opioid ability workshop with them, which is on the month of October, where even the health secretary was present along with all the other important officials. So out of that initiative, and also meeting them, and we'll come out with a draft MOU of improving the palliative care services in the state of Arunachal Pradesh, which is with them. So we hope to, have that kind of agreement with them probably by next month. Yeah, next slide, please. Yes, in Manipur is doing excellent work, I can say. This is my personal take. So we met an NPC nodal officer, so Dr. Tilakreswari. And they have, in fact, out of their, no, the last slide, out of their 16 districts, the district, 9 districts have already been approved for their for offering palliative care services. It's 2018-19. Yes, the next slide. Next slide. Yeah. So you can see right next to Salini, the drugs controller is sitting. So here also, because of some local challenges, they could not follow the new process, but definitely they are looking forward to it. We could also discuss with him and share more very important documents. So, and yes, so we were received well, and I believe that, and he also understood many other process of, how to go ahead, because right now what we have seen out there is that, like, he doesn't have a team. So that is also one thing that he is considering, and also helping the private institution to get the RMI license in the for through the new process. Yeah, next slide. We met Dr. Joginder. I believe many of you will be familiar with him. He's standing on the left extreme side. So Dr. Joginder also is running a charitable organization called Palliative Care Society, and in fact, they were the first one. I think it was 2015. The palliative care services was initiated in Manipur. So Manipur, in one way, I can say that they're growing very fast, and even their government are they all are coordinating very well, and they're trying everything to develop this palliative care and reach to great heights. Yeah. Next slide, please. Then we visited Nagaland also. Nagaland, we visited the government hospital, Naga Hospital. So we had a team of doctors, even the managing director was there, and we proposed for an project proposal, and also for a tendon on site with them, and also for a CME. And we are in the process of having that by next month. So we can say that it's growing out here as well. So it's nice to see, to know about when we visit those states. Yeah, next slide. And we met the principal director, which was very important to meet important people, because that's how actually we can reach out to more masses. So and he was very nice to spend time with us and understand, and he did request to us to send us the project proposal. Yeah, next slide. We met the joint secretary as well. Unfortunately, we could not meet the principal secretary because he was busy in a meeting. But yes, so meeting her was also very nice, and she also encouraged us to work on that. Yeah.
Just wanted to add, if you see, all these are government officials, and along with the government officials, we have Dr. Tete of Nagaland, extreme left-hand side, and then we have, I'm forgetting the name, Ron, if you can help me.
Dr. Tina.
Dr. Tina. Yeah. And they were the local people who wanted to develop palliative care. They are the doctors who wanted to develop palliative care, but they wanted support of their administration. They wanted support, they wanted support of the government. So we went to the Directorate of Health Services. We went to the Joint Secretary with them and tried to get them the support, the funds that they need, because they are in Naga Hospital, which is a government hospital in Kohima, and they wanted that kind of support from Pallium India, and that's what we provided. So this is the kind of support we can give it to you if you are interested in opening up a palliative care center. Sorry, Ron, sorry for interrupting. Please go ahead.
And we also met father and sisters from the churches, Joseph Palliative Care. And in fact, they were very kind enough to take us to their new upcoming hospice, which will be, the foundation will late in March 2022. And this is the work that is happening. So this will be exclusively first time in Dimapur that will be set up, and looking forward to it. And in Sikkim, yes, so we visited this Rumtek monastery where, they are keen in developing a palliative care community. So that's where actually that's why we just, we land up out there, we visit them, we met them earlier, we have spoken with them earlier also. So they want to start something out there. So we look forward to it, yeah.
Just wanted to add here, if you see on the extreme right is a volunteer of Rumtek Monastery. She lost her dad to cancer and she wanted to have palliative care services within her community. That's what she made us meet the head of the monastery, so that with his permission, we can have doctors from the Gangtok hospitals to come and talk to them, create awareness in their community, and help them have a palliative care center. So this is how we are just trying to connect everyone together so that the palliative care centers can come up. Go ahead, Ron, sorry.
And yes, and then also, we met the government official of Sikkim. Like you can say, all of them were there, from the director to the MD NHM to the principal director and all the important doctors. And we had a wonderful discussion with them. And yes, they are very keen. They were also interested to have a state policy. So yes, we are working with them, and yes, and we'll keep in touch with them. Yeah. Next slide. And we also visited Namchi, which is in Sikkim. So we met the CMO. And we have Dr. Sangeeta on the right-hand side. In fact, she is the in charge of palliative care in Namchi District Hospital. So she's helping us across the states of Sikkim in developing a palliative care. And they are very much keen, and they have already, they have a good network of volunteers also, in fact, who got trained from Pallium. And they are building their team and they are growing up. And I believe that, soon they will have all this team ready. And we also have this awareness. Actually, we were invited by a volunteer, Ms. Anju Pradhan. She runs a hotel management institute. So she told us that why not come and give us a, awareness program for the students. So this is what we did. And Dr. Sangeeta will work with them closely in taking forward. Next slide.
Ron, I think in the interest of time, we might want to go a little faster.
Yes, I'll
yeah.
go fast. Sorry for that. Yes.
No,
okay. So we visited
time,
West Bengal. So it was wonderful time visiting them. So we were there. Dr. Rakesh Roy was already there. So they had a great team, and we look forward to them. And also we have the Eastern India Palliative Care team, like with Mr. Pranab Basu. Many of you might know him. So they had a great team together, and their objective is to reach out to collaborate with other NGOs to reach out to all the other districts of West Bengal. Yes, next. And we, in fact, EIPC runs 5 kiosks in, the different hospital offices. So yes, and we also, yes, and then these are the, one of the kiosks that we visited. So yes, they help the patients. Next slide. And we also met the West Bengal government, very, very welcoming. And then we look forward, we already talking with them on the proposal. So we believe that, we can submit the proposal soon to them and we will start working with them.
Thank you, Ron. So, thank you so much.
Sorry, sorry, I took so much of time. Sorry for that.
No, I think we'll quickly move. So we have, sorry, Mr. Rajendra Dutt is not around. He's looking after these 12 states in the northern region. His number is given, so please feel free. You can reach out to any of us and we can share the number also later. But we'll quickly move on to Vishnu. He definitely talked about and helped setting up a palliative care center in Sub-District Hospital Ambala, in Gurbachan Memorial Hospital in Ludhiana, Punjab, in Bilga General Hospital, Jalandhar, Amritsar, Punjab. He worked with another hospital, Dayanand Medical College, in Himachal also he worked with a group of doctors. And so I think I'll let Vishnu take over now and talk about his experience. Vishnu, please, all over to you.
Thank you, Shalini. Good afternoon, everyone. My name is Vishnu. I'm handling the South of India region. Yeah, am I audible? Okay. So yeah, I am the regional coordinator handling the South of India region. Basically the states of Kerala, Tamil Nadu, and the Union Territories of Lakshadweep, Puducherry, Andaman and Nicobar Islands. So if you are from any of these regions, I am the go-to person. Shall we next slide, please? So I am the new person in this state facilitation team, just barely 1 month in Palliative. So these are the process which I am associated with lately. So first one is starting a palliative care facility. So this is the ultimate objective of the SF process, to create and launch palliative care centers in each and every district of our country, or in our region specifically. So for example, this is a new upcoming project in Chennai called Kaide Millet Center for Humanity. AI KMCC and Crescent Hospital in Chennai is planning to launch a palliative care facility in Chennai. So we will be supporting them to recruit a physician, give them the adequate training, and to support them to build the IPOP and home care facilities, the infra facilities, all those processes. Basically, holistically, we are supporting them from scratch. It's an infant stage project. The second thing is, as Shalini mentioned, that's the recruitment of palliative care physician, nurse, or allied health workers. I'm working with Dean Foundation Chennai and Rajagiri Hospital Kochi for recruiting palliative care physician. So if any one of you are associated with any facilities, or if you're planning to start your own facilities in future, you will be likely to recruit new physicians or healthcare workers in your facility. So we'll be sending you an advertisement format. You could fill it up and send back. We'll post it in our website. We'll share among our networks and third-party website. We'll try to get a suitable person for you. Ideally, if you're looking for a job opportunity also, we'll share in your WhatsApp groups after your training is completed. The next thing is the education and training of doctors and nurses. Basically, you know, Palliative India is a pioneer in training and palliative care in our country. So I'm working with Tamil Nadu State NHM for training their doctors. I think it's around 400 physicians are there. Due to COVID, we have already completed one virtual batch, and following batch will be conducted in on-site format at Chennai. So the next one is really important one, as Shalini said, registered medical institution issual and renewal. So basically, if you are associated with the existing facility, or you are planning to start on your own facility, you should be aware about this RMI process. Basically, you should have an idea that before 2014, there was this old tedious process to renew this issue of the certificate or any paperwork related to government agencies. Basically procuring, dispensing, processing opioids, morphine, methadone, any kind of opioid usage in your facility. You should be aware about this RMI issue and renewal. Right now, I'm working with, so I'm working with Tamil Charitable Trust Lakshadweep and for the RMI renewal basis, and the new stakeholder is I'm working with new stakeholder in Chennai for the renewal, the issual of their RMI certificate. Basically, all the stakeholders, most of the stakeholders are not aware about the new RMI certificate process. They're still used to the old tedious process of the RMI certificate. And the next is development of training institute. We are working with PSD Medical Institute Coimbatore and Atulya Living Homes Chennai for developing a training institute for their care facility. Basically, Atulya Living Homes is a for-profit project. As Dr. Sanjay said earlier, it's really good to know that more and more for-profit initiatives are coming to palliative care. The discussions are ongoing. Once we finalize this, we could connect with you, Doctor. Yeah, that's it from my side. Anything else, Shalini?
Thank you, Vishnu, and thank you to all the regional coordinators for running it through so quickly. I took the maximum amount of time, but I hope, doctors, you have found this session helpful in organizing a palliative care. I am sorry we are not left with much time to answer any questions. We were planning to, but if there are some quick ones, we can take it. And if you want to stay on for another 5 minutes, we can quickly take on any urgent ones. Otherwise, you can reach out to us. these are, we have shared our numbers, and I will quickly put up, I think it has been shared with our, on the chat box also. So if there are any questions which we can answer right now, I'm happy to. Dr. Sangamitra, I think I will hand it over back to you. If I'll just put the our information on the
Shalini.
screen and leave it like that for everyone. Thank you.
Yeah. Shalini, that was really wonderful. In fact, I think I left Palliative India way back in 2010 after my training, and I haven't been there since such a long time. I have been in touch with everybody in Palliative India, and Rontu is right now the point of contact for me. And of course, I do sometimes talk to you too. I want to introduce my new associate. You can see her. She's Ayushri. Ayushri has joined me. We have started a palliative care, home care system for the city of Guwahati. Shared today with all the doctors, and actually she was actually asking where is this training and how to go about this. She is a very small girl, around she's a graduate in geography, yet interested in palliative care. So Rontu, I might actually give you some responsibility to give her some contacts or some learning about palliative care, how you came to palliative care. So this is Ayushri. So yeah, so thank you all the participants, everybody. I'm sorry that I've barged into some of my own things inside today by introducing Ayushri to all of you. Anyway, it was an excellent session, and I'm absolutely sure that all of you must have got some knowledge about how to start palliative care and keep it going, because that is what perhaps we need as of now. We have been having a lot of capacity building in the past also. What I personally feel is that we must also generate jobs for those doctors, nurses, and volunteers and social workers who would like to stay on motivated in palliative care. I hope all of you agree to it, and we all must work towards that particular thing. So thank you so much. Shri Priya, over to you.
Thank you, Dr. Sangamitra, and thank you, Shalini ma'am, for such a wonderful session. As somebody told in the chat, you guys are really rocking the state facilitation team. I believe it was really an eye-opening session for everyone out there. And so with that now, this is Shri Priya along with Dr. Sangamitra and Shalini ma'am signing off from Tips Recorders. Happy New Year, everyone. Stay safe, stay healthy. See you in the next
Thank you, everyone.
Bye-bye.
Happy New Year to all.
Thank you.
Happy New Year. Bye-bye.